Hi, and welcome back to the CyberKnife CK Cam. I'm Sasha, and I've been joined by Catherine, who's the Senior Manager of our Patient Relations team. Catherine, can you tell us a little bit about your role here at Accuray?
Sure, and hi everybody. My role at Accuray is essentially to help educate the patient. So all of the patients that come into the company, it's our responsibility to basically inform them with the information that they're looking for. So for example, if you're a lung cancer patient and you're looking for outcomes on stage 1 or stage 2 lung cancer, we would have that information that we could share with the patient. We also help patients who want technical information about the CyberKnife. For example, if you're a prostate cancer patient and you want to understand the nuances between an IMRT treatment and a CyberKnife treatment, we can help you kind of get your head around that information as well.
I understand that you guys also work with a lot of nonprofits as well.
That is true. We work with many patient support groups from really all over the United States and actually even a couple abroad. And our responsibility with those organizations is to help educate them about the CyberKnife and keep them up to date on clinical advancements, if you will, with the CyberKnife. So that's another really fun thing that we are involved in as well.
And you guys also work really closely with our reimbursement or patient access team, right?
Yep, absolutely. Occasionally, patients are denied treatment access by their insurance company, so it's very important that those patients understand really how to maneuver through the system, you know, what types of things they need in order to get their insurance company to actually overturn that decision. So it's our job to really educate them, and we work with a great team here with patient access, and they have a lot of information that we can share.
So you guys essentially give them guidelines and tools to help work to overturn if they had a negative coverage decision.
Exactly. And just because a patient is denied coverage doesn't mean that that's the end, that they're not going to get it. So it's up to us to really kind of help educate the patient if they're willing to go through those next steps on how to actually get those cases overturned, hopefully.
That's really great. What resources, patient resources, are there out there for people who are looking for more information on the CyberKnife?
Well, the Marcom team, the marketing communications team, has put together a really fantastic website. It's www.cyberknife.com, and it's really geared for patient education. So if you're a patient looking for any kind of treatment indication, if you're looking for a liver tumor treatment or a lung tumor treatment, you can actually go to the site and actually go to that specific section and look and read about the CyberKnife and also how other treatments are used to treat those kinds of cancers, for example. And we also have videos, which are really terrific tools for patients as well. So I think, if you see a visual and sometimes you can also read something, it helps you gain a better understanding of exactly what you're looking at in terms of technology.
That's great. And there's a forum on cyberknife.com as well, right?
Absolutely, and thanks for bringing that up because it's probably our most popular section of the site. The forum is called Ask the Doctor, so patients can basically write in and ask questions about their treatment, and we have 3 physicians that donate their time. Dr. Medberry, Dr. Fuller, and also Dr. Spunberg all volunteer their time and they help answer patient questions. And the cool thing about the site is that you can actually go there and read other postings. So you don't have to participate as a registrant. You can actually go in as a visitor and just sort of peruse through some of the questions and answers, which is a really good resource, I think, of information for patients.
Absolutely. So if you are a patient who had a CyberKnife treatment and you just want to share the word and get it out about the CyberKnife, what are different ways that they can go about doing so?
Well, there's lots of different ways. Actually, one of them is the internet. The internet, provides a fantastic medium for patients to express their experience with others. Blogging is also another one. We have patients that actually have put together a blog, which is fun, so we can sort of follow those stories. We have a Facebook page, we have a Twitter page, which is a lot of fun as well. One of the things that we haven't talked about yet is our advocacy program. So if you are a patient that has been treated, we actually have an advocacy program. So if you're a lung cancer patient, for example, that's contemplating the CyberKnife, we have a mechanism to actually connect you with a patient who has been treated. And that provides a lot of comfort, I think, for patients sort of contemplating the treatment. We also have an advocacy program that we bring patients to Washington, D.C., and those patients get to meet their leaders in the House and the Senate, and they get to share their stories. We have avenues where patients can actually testify at hearings, for example, to help provide more patient access for everybody across the board. So there's actually a multiple, variety of things that you can do. Not all including the internet, but I think probably one of the most important things is really when patients talk to their family and friends. I mean, I think that, I don't know how many calls I get a day, but a lot of them are actually, hey, I was talking to my friend about this and I hadn't heard of it before. My doctor never mentioned this to me. So this is a really great way to actually, get the word out, is just to talk to friends and family.
Those are really great tips. Thank you. If you had one, I guess, final word of wisdom to patients who are looking for the best treatment option for them, what would those be?
Well, absolutely, to be your own advocate, or if you're very ill, to get somebody who can advocate for you. Oftentimes, patients will contact us and they'll want to know, why haven't I heard about the CyberKnife before? Well, it's not that we're not, helping to get the word out, but the truth is that there's only really a handful, here in the United States.
It's about 190 worldwide?
About 190, I guess, worldwide, so almost 200 systems. But still, if you happen to be treated at a facility that doesn't have a CyberKnife, it's probably unlikely that your physician is going to, recommend this treatment. So if you are your own advocate, go out there and try to find as much information as you possibly can. And I think that a well-educated patient is really well-informed, and they're also in the best position to make, a decision about their treatment.
That's awesome. Thank you so much for your time, Catherine, and thank you for watching. I'm Sasha with the CK Cam. See you next time.